My name is Sarah McNerlin and I'm a doctor of physical therapy for over 10 years. And today I want to talk about red light and near infrared light. In the clinic, I love to use red light therapy modalities for a variety of things. So first I want to introduce you to the concept of red light. Red light is a device that emits a certain wavelength that penetrates through our cells in a different way than some of the other lights on the spectrum. In particular, I like to talk about or use both red light and near infrared. They target different depths of our tissues and have different things that they are good at. Red light in particular targets superficial tissues, and the near infrared light can target some of those deeper tissues, which then can cause changes in some of the deeper cellular levels. You could get into the really nitty-gritty science around it, but the long of the short, or how I like to describe this in the clinic, is that the red light can penetrate into our cells and it stimulates the part of our cells that increase our production of ATP. So ATP is what is responsible for producing power for everything. And so basically we increase our cellular body's capability of doing work, which means that we can be more efficient at rebuilding, cleaning up, and healing things. So red light and near infrared light just speed up and help out our natural healing process in a big way. On top of that, red light can also reduce oxidative stresses. So oxidative stresses are things that happen in our cells that trigger change or healing. If we have too much, we can have inflammation. If we don't have enough, we don't get the cell turnover and kind of the cleanup process that we need. This red light therapy can help titrate that response. So it'll speed it up or increase it if we need it, or tamp it down if it is in excess. The last component of red light is it increases our nitric oxide response. Nitric oxide brings blood flow to the area. So not only can we increase our cellular capacity by increasing our ATP, we can also increase the blood flow, which then allows for us to increase the amount of materials coming in and out of those cells. So the research is still a little all over the place, but generally speaking, we believe that red light and near infrared light can help with tissue healing. It can help with nerve conductivity, and it can help bring blood flow to areas. It's also good at interacting with our pain system and decreasing our pain in real time. In the clinic, I really love to use red light and near infrared on athletes who have had a traumatic accident. So if they have bruising or inflammation, tissue healing is occurring, the red light can help speed up that process. This is a device that I really like. This is called the LumeBox. I like the LumeBox because, one, it's pretty portable, and I can kind of direct it at any part of a patient's body that I want, but it also comes with both the near infrared and the red light settings. So you can kind of see it gives off a lot of light. And so this is both the red and the near infrared. There's just the red, and then the near infrared you actually can't see. It is a wavelength that is not visible to our eyes. So I will pair this treatment with dry needling, I'll pair it with tissue work, I'll pair it with therapeutic exercise, and it can help enhance the recovery, decrease the pain, and improve tissue healing. I've actually used this in my own body. I was in a go-kart accident where I had a huge hematoma on my body. And I used the red light a couple times a day for a few days, and that hematoma cleared up significantly faster than I have had bruising and hematomas clear on my body before that. The other application for this is cosmetic, so you can use it on your skin to improve your collagen production and all of the same ways that it helps with our cellular process in our muscles. It also does that to our skin cells. So a very common and popular way to use this is for a cosmetic or dermatological effect. And so this device is also great for that. The advantage is you can use some of that near infrared for other tissues in our body and even our faces or other places that we're looking for decreasing the effects of natural aging in our skin. One thing to note about red light and near infrared light is consistency is key. In order for this to be effective, you need to be dosing this fairly high, including daily or multiple times a day. As your body gets more used to it, you can kind of taper off of that a little bit, but in order for us to see maximal benefit, we've got to be using this on a regular basis, which is why something like a home unit can be really helpful if those are your goals. What questions do you have about near infrared or red light therapy? Ask them below. And if you want a discount code, check out the link below. You can get $260 off of the LumeBox.